Hi everyone, I'm Dr. Karam, board certified facial plastic surgeon. I specialize in facial rejuvenation, which basically means I help people like you look as young as you feel. And today I'm going to break down a very important question that comes up, and that is, what do I look for in a facelift surgeon? I'm going to give you 5 things to look for and 1 thing to make you run for the hills. So let's break it down. So number 1 is board certification. Board certification basically tells you that your surgeon is qualified under the American Board of Medical Specialties to perform the particular operation that you're interested in. In the case of a facelift, there's 2 boards that give you certification for that. One is the American Board of Facial Plastic and Reconstructive Surgery, and the second is the American Board of Plastic and Reconstructive Surgery. Those 2 boards are the ones you should be looking for. That tells you that your surgeon has gone through medical school, passed all the qualifying exams, gone through a residency and or a fellowship, taken a certain number of cases, presented it to the board, and basically got the check and sign off that you are in fact qualified to perform the surgery. Now, why is that important? Because it gives you a baseline understanding that your surgeon is in fact a good surgeon, in good standing by the American board, and that they fit under the fellowship and they didn't just take a weekend class or take a seminar and they are now performing facelift surgery. This gives you some sense of security of the scope of training that your surgeon has undergone. Number 2, knowing that you've met the board certification, the second most important thing to look for is specialization in facelift surgery. So let's understand this for a second. So I mentioned 2 boards that give you proper coverage. That doesn't mean that your surgeon, who is either a facial plastic surgeon or a plastic surgeon, performs facelifts on a regular basis. That doesn't mean that this is part of their scope of weekly or daily surgeries they perform. And why that is important is because you could be a plastic surgeon, for example, and most of your practice is rhinoplasty and nose jobs or cancer reconstruction. Same thing with plastic surgery. You might be doing breast and body work and liposuctions and abdominoplasties and reconstructive procedures, but you're not doing that many facelifts. That right there is an important piece to it, because facelift surgery is intricate, it's difficult, it's your face at the end of the day, you can't afford to get it wrong, and doing it right is very, very important. So finding a surgeon who specializes in facelift surgeries is very, very important. Number 3, experience. Why is experience so important? Because experience tells you that your surgeon has been doing this long enough to where they've learned from their mistakes, they have applied those mistakes into practice, and now they're doing the surgery better over time. That's how surgeons become better. That's how anyone in any profession gets better. It's sort of that old motto, practice makes perfect. So having lots of experience in the particular procedure that you're interested in, no matter what medical specialty or medical procedure you're interested in, is good advice. So find somebody who specializes in these procedures and does them regularly. So that indicates volume. So that's a simple question. How many of these procedures do you perform each week? How many of these procedures do you perform every single month? If you're hearing the answer is like 1 to 2 a month, 3 to 4 a month, that's probably not enough to give you the assurance that you're going to be in the hands of a specialist. To give you a point of contrast, for example, I do anywhere between 6 to 8 facelifts and facial rejuvenation procedures every single week. That's all that I do. That's an important point of comparison. Not everyone has to do as many as I do, but that's just to give you a sense that you can have a practice, but it's not giving you enough of the volume to get really good at something. Number 4, technique. So what does technique tell you? Technique tells you that you're gonna get something that's gonna leave you looking natural, that's gonna give you something that's gonna last years, that's gonna give you reproducibility. So there's so many different techniques in the world of facelift surgery. And I don't wanna go down and break down each one of them, but I'm gonna say, generally speaking, people wanna look natural, they want a procedure that gives them basically full correction, or as close to full correction as you can to their jawline and saggy neck, and they want it to last. Those are the 3 basic things that people want. So technique helps with that. So there's certain techniques that give you that type of reassurance. Number 1, and probably at the highest level, is the deep plane. Deep planes have been around for 40 plus years, and they've proven to be, generally speaking, more natural looking than general facelifts, and they definitely are more lasting, and if you do the technique properly in experienced hands, they're gonna be very reproducible and safe. That's one thing to look for. The other components are anyone who's doing a very good SMAS type facelift is probably significantly better than doing like a weekend facelift or a mini facelift or a skin lift or anything that's sort of one of the marketing as one of these low downtime procedures. Because I can tell you from experience, no one really cares about downtime as much as they do about getting a great result. So make sure the technique is good. And for example, my technique, the vertical restore, is based off of the deep plane approach, but it combines the lateral brow elevation, it allows the neck lift and the mid facelift. So it's 4 things in one. The technique allows for reproducibility, longevity, and a supernatural look, and partially because of the vertical nature of it. So I am a big fan of any vertically based lifts, because the fact that they, generally speaking, look a lot more natural looking than anything that goes sideways. And unfortunately, what's out there is a majority of surgeons are still performing the traditional facelift, which is more or less a sideways or horizontal lift. So I'm not a big fan of that. I think these are things that you need to decipher and question. Vertical is better than horizontal. The 5th, you need to see lots and lots of examples. So you need the proof in the pudding. Basically, when you see lots of examples, it's going to answer a lot of questions. Number 1, it's going to tell you, are these results natural looking? Are these results reproducible? Is this person only producing, if they show you 5 of their best outcomes, well, what about the rest of them? How do they look? That's a really, really important part of it, because you want to see the reproducible and consistency, because it doesn't matter if once in a while a surgeon gets it right. If you're on the table and they don't get it right for you, then you're going to be bummed out about it naturally. Before and afters are key, because they're going to tell you a lot. What do they say? Picture is worth 1,000 words. It really will answer a lot of questions there. So make sure you see lots of examples, and they make sure they hit your criteria of natural, reproducible, leaving you looking like yourself, etc. So those are the 5 big things. Let's review them. Board certification. They are specialists in facial rejuvenation or facelifts. Number 3, they have lots of experience performing these. Number 4, they have good technique. Vertical is better than horizontal. Deep plane is better than traditional SMAS. Number 5, lots of examples that prove natural, reproducible, and consistent. So what's the one thing that should make you run for the hills? It basically comes down to a feeling. Aside from those things that you need to look for, what's the feeling that the surgeon gives you? Do you feel trust? And I would put trust as probably the culmination of everything, every interaction you have with the surgeon, their staff, the research you've done, etc. It's a gut feeling that you get. And if you don't have it for your surgeon, I would definitely not move forward. And I'll tell you why. This is a very important relationship you're forming with your surgeon. You're basically going into a situation that's going to leave you feeling very vulnerable, very emotional, and at the other end, you need to come out looking like yourself. And if you don't feel comfortable with your surgeon, they don't give you the sense of trust, then as you go through these steps, you're going to have a 10 times more difficult time going through them. But more importantly, if things don't go right, you're going to kick yourself for moving forward with a surgeon that you didn't feel completely comfortable with and trusting with. So trust is really important. And that's a culmination of reputation, the interactions you have. Are they dismissive? Are they engaging? Is the staff on board? Do the staff give you a sense of confidence? Do they believe in the surgeon? All of those things are really, really important in formulating that sense of trust. Now, let's add one more layer to this. If all 5 of those criteria met and you have a sense of trust, no matter what the cost of the procedure is, no matter where they're located, you go for it. If you don't feel those things, if you happen to have a surgeon that's literally down the street from you, super convenient, but you don't trust them inherently, don't give them your face, because at the end of the day, your face is such a precious thing. It cannot be covered, it cannot be hidden, and it is the source of your sense of self, it's your source of sense of confidence, so it's important to get it right. When it comes down to cost, I always tell patients, do your homework, meet these above criteria first. If a surgeon is less expensive than another one, then go for that surgeon. But if you don't feel it for that surgeon, but you do feel it for the surgeon that's more expensive, and you feel more comfortable with them, and you believe they're going to give you the best result, then just wait until you can finally afford it, as opposed to just going with the next surgeon that you don't feel comfortable with, but you can't afford, because ultimately, doing a surgery a second time is much more taxing emotionally, but it's also much more expensive financially. So you definitely want to make sure that those criteria that I mentioned are at the top of the decision-making criteria, not convenience and not price. In our practice, 70% of our patients travel from literally all over the world for their procedure, and I assume that the reason is because they believe I can do the right job for them, and I give everything I can every single day to make sure that I meet that set of expectations and that they're happy with their decision, that the trust that they feel from me is earned. So that is some solid advice. I hope you take it to heart. Good luck with your endeavors. If you have any questions whatsoever, drop them in the comments below. Share it with some friends and family and people who you think should know this as well. And if you haven't already, make sure you subscribe to this channel because I will be giving you information like this at least a couple times a week. Thank you guys so much. Dr. Amir Karam.